So thank you everyone for joining us for this live Q&A. It's my pleasure to introduce our speakers that have joined us. Today we have Jeffrey Chalmers, Professor of Chemical and Biomolecular Engineering at The Ohio State University. And also joining us is Tiffany McNamara, Scientist of Cell Line Development at Sanofi. So thank you so much for joining me today both. A quick note to our attendees, please do comment any questions for our speakers on the chat box on the right-hand side of your screen. We are live and I will be able to ask any questions that are submitted directly to our speakers. So without further ado, we'll get started and I'll direct my first question to Jeff. So Jeff, could you tell us what the biggest challenge encountered during this project was and how you were able to overcome this?
Yeah, just a second. I'm turning my speaker up so I could hear you better. You guys hearing me all right?
Yes, perfectly.
Seems as though my mic is always fine. My computer speakers are the culprit. The biggest challenge was COVID hit because we've been right in the middle of this project. So it's delayed everything. Then on top of it, he was my student doing the work was at Catalent, and then they were doing a whole bunch of contracting to make vaccines. So the whole system went into, let's say, intensity. How's that?
Absolutely. Would you be able to kind of give us more information on what the direct repercussions to yourself and your lab were from COVID?
Oh, well, that at least we got some work done. I've got other research going on where we do work with human blood, in particular sickle cell patients. It's shut down for a year. A whole year we couldn't get blood. And the real irony is 6 months after we started getting it, we're getting results that are just amazing. Without getting into details, right? It's a different topic, but really what we wanted to achieve, and we're doing it. And I wrote a grant that didn't even get reviewed well. And if I'd had that data, I know I could have. So see that my take home message is the impact is going to carry on for a long time, because it's not just shutting the system down. It shuts down the data, then shuts down, the whole system of getting funds to do the work. And we still have to pay our students, right? So the money just kind of goes poof. So yeah, but hey, I have a job, students have jobs, I shouldn't whine, but I don't want to sound whiny. I just want to say that there's all sorts of profound effects. Those of us that are old, it's not as disruptive to us. Who's really hard on is the young people, especially people with young kids who, so I don't want to sound whiny compared to the problems they've got. Anyway.
Of course. No, it's so difficult and you don't sound whiny at all. It's all about bringing awareness, isn't it, to the different elements and the different struggles encountered. So thank you for sharing. And I'll direct another question now to Tiffany. If you'd be able to tell us regarding your presentation, how long did the process take from start to finish?
So the whole process from start to finish was about 2 months. So it's not very long, a lot of work in 2 months, but it actually didn't take too long to actually get to the end results.
That's great, thank you. And Jeff, would you be able to tell us, perhaps, I don't know, on a more positive note, what upcoming strategies or technologies you can see coming into the industry that would advance your work further?
We're, in addition to putting these slides together for you, the students, we're trying to get a student graduated related to this whole business of being postponed and everything, but we're sort of in parallel putting it all together. One of the things I noticed is we're still, the whole question of suspended animal cells and being damaged never goes away. People have always been asking about this for 40 years now, or 40 years. Now we're using these perfusion systems to get really high density. Everyone's going towards that. And what part of the take-home message is we saw, these cells, in fact, the perfusion system runs better. So that's a nice thing to see how things are going. But we also uncovered issues with pumps, which I didn't really talk about much, but there's limits to how much you could, what kind of pumps you can use and how fast you can run. So that's actually a new opportunity for us. And it's related to my blood work as well. There are pumps that work and don't work. So we're studying that right now. So that's the long term, where I'm known for doing shear stress exon cells for 30 years. And I'm still banging away a little bit at it. And now I'm looking at pumps. And it kind of makes sense when you think about it. It's not the bioreactors, but moving the cells around can be an issue. So that's what I'm looking at now. Pumps.
Great. Thanks very much, Jeff.
And Tiffany, what do you do? I'm going to take over for a minute.
Please.
But Tiffany, your job duties are in general what?
A lot of cell culture. So I'm a scientist in cell line development. So we make all of the cell lines for the biologic therapeutics at Sanofi. I specifically do a lot of the gene editing of the CHOK1 cells. But in general, our department does a lot of cell culture, and we don't work with the bioreactors as much. We work with Amber, so little tiny bioreactors, but perfusion is a big part of the process downstream of us a little bit.
Mm-hmm. Yes. No, I'm a Sanofi, and which location?
I'm at Legacy Genzyme in Framingham, Massachusetts.
That's right. Sanofi bought Genzyme. That's right. I thought about that. Okay. I've known people off and on at Sanofi. Some of my past students are there too.
It's a great place. That's good.
Sorry, Emma. Is that all right?
No problem. That's great. Absolutely. If you have any questions for each other, then please, I won't stop you. But Tiffany, while you're sharing about, your current work role and what you do day to day, would you be able to share with us perhaps some of your priorities over the next year or so?
Oh, sure. I actually don't know how much I'm allowed to say. So the main priority, I think, in the next year is to have a very highly productive host cell line that can produce at least 10 grams per liter for the majority of our platform. So our different antibodies. There's a lot of different, I think every company has a lot of different challenging modalities coming through. So they're not just regular monospecific monoclonal antibodies anymore. There's a lot of trispecifics, bispecifics, fusions, nanobodies, everything coming through. And so I think the biggest challenge, and priority would be to generate or have a host cell line that is able to express all of these very well and with very high product quality as well as high titer. And that's kind of a priority for us and downstream of us, including if you want to go with people who do bioreactors and the perfusion system. So that's a big thing for this next year.
What cell density? If you're targeting 10 grams per liter, you must be also talking about higher density. Don't tell me you're doing that at 1 million per mil or something.
Oh, no. Yeah, I don't know how high exactly they'll get to, but I think with perfusion processes you can get pretty high, right? So I think we can get to a decent cell density. I think just having a really highly productive host cell line is the main priority for the next year.
Give me a heart attack if you were getting
in 1 million cells.
Yeah, I was gonna say, oh my gosh.
Yeah, that'd be the best SPR ever though.
Yeah. Although I always I make cracks about this. I talk about it in class. I was at a cell culture meeting, 1990, 1980, maybe it was 89. And, they were getting milligrams per mil, if that. And, in those days, if you told me we would get 10 grams per liter, I'd be like, yeah, what are you smoking? You're nuts, right? No one would have thought that we'd get this. So that's why I asked, because you never know. Yeah, it's amazing what we're doing. For Emma, again, I don't want to embarrass you. You might not even been born then when we started this, It's been fun to watch the field just explode in front of us, There's not that many fields that have really taken off that fast. Computers have, right? But you could argue it took even longer than this because the cell phones really, where it really exploded was probably the cell phones when you think about it, it's just real, or the internet, but
Mhm.
World Wide Web type things. But anyway,
Yeah, no, it's amazing.
Yeah, it's fantastic to be part of such an exciting area and field and industry, I'm sure. But I don't want to bring this to a close at all. It's been a fantastic chat, but we have run out of questions from the audience at this stage. So if there's anything else you'd like to discuss, then please do feel free. But otherwise, it's been a real pleasure chatting to you both and asking you questions. And I want to say a massive thank you as well for both of your presentations. And that does bring a close to the digital day of the Cell UK. So just a massive thank you from me and from all of our delegates as well.
welcome.
Thank you so much.
Thank you.
Thanks. Bye.